Migraine, it's not just a headache. Welcome to MedEd 360, where we simplify medicine for everyone. Just imagine a headache, so intense, it feels like your brain is under siege. This is the reality of migraines, a condition that affects millions worldwide. But what causes these debilitating headaches? How can you tell if it's a migraine or something else? And most importantly, how can you find relief? Let's explore the science behind migraines, their triggers, symptoms, and effective management strategies so you can take control of your health. So let's start. We begin by asking the question, what is really a migraine? Migraine is not just a headache, it's actually a complex neurological condition. It involves changes in the brain and its blood vessels, often triggered by factors like stress, hormones, certain foods, and even weather changes. Some individuals, especially younger women, are more prone to developing migraines than others. Migraines usually occur in episodes, and it starts slowly and can last from minutes to 4 hours and up to 3 days. They affect not just the head, but also your overall quality of life. Now, let's talk about the symptoms of migraine. The symptoms of migraine can vary, but often include throbbing headache, usually on one or maybe on both sides of the head. Sometimes this feels like that something is sticking to your forehead and it's putting pressure on your brain. Imagine the agony. Another interesting symptom is photophobia, that is, sensitivity to light, making daily tasks unbearable, and patients often find comfort in pitch-black dark rooms. Similarly, patients may also have phonophobia, that is sensitivity to sound, and the patients often look for a quiet place. Another, almost universal symptom is severe nausea, which can lead to vomiting as well, especially in severe cases. This nauseous feeling is almost always too extreme and is very distressing for the patient and is an important component of the management, as we will discuss later on. Something very interesting happens to some patients with migraine as they experience what is called an aura. They may experience visual disturbances like zigzag lines or flashing lights, even before the actual headache begins. And this can give them an alarming sign about the beginning of a migraine episode. Migraine can also lead to fatigue and brain fog that can linger even after the pain subsides. After discussing about the symptoms, let's shed some light on the triggers of migraine. Migraine triggers are highly individual, but common ones include stress and anxiety. They are a very common trigger for migraine headaches. Hormonal changes, especially in women during their menstrual cycle, can trigger migraine in susceptible females. Certain foods can also act as trigger, like aged cheese, chocolate, processed meats, and caffeine and alcohol in excess. Another important trigger for migraine is sleep irregularities, whether too much or too little. And also the excessive screen time at bedtime, especially the blue light, is increasingly being associated with migraine headaches nowadays. Now comes the important aspect of any condition, that is the diagnosis. How is migraine diagnosed? Unfortunately, there's no single test for migraines. Diagnosis is based on your medical history, symptoms, and physical examination for ruling out other conditions that can lead to headaches, for example, decreased eyesight or sinusitis. Your doctor can also order imaging tests, like an MRI or CT scan of the brain, if the headache patterns are unusual or new or extremely severe. Okay, so once confirmed, what are some of the management strategies to tackle migraine? Managing migraines involves both preventive and acute strategies, including lifestyle changes, acute treatments, preventive medications, non-pharmacological options. Managing migraines with lifestyle changes is as important as taking medication. These changes include sticking to a regular sleep schedule, eat balanced meals and avoid skipping them, practice stress management through techniques like yoga, meditation, or deep breathing. Once the migraine develops, the acute treatment should be started as soon as possible. The key is to avoid the migraine as early as possible, as delaying it will result in a more prolonged and severe migraine episode. Over-the-counter pain relievers like paracetamol or ibuprofen work for mild migraines. For moderate to severe attacks, triptans such as sumatriptan are first-line medications that target the cause of the pain. These should be prescribed by a qualified doctor as it can have annoying side effects. During a migraine episode, the gut's ability to empty is often slowed, which can reduce the effectiveness of oral medications and also the nausea during the episode. To address this, gastroprokinins like metoclopramide or domperidone should be used early, ideally before pain relief medications. These drugs enhance stomach emptying, ensuring that pain relievers are absorbed quickly and effectively, improving the chances of aborting the migraine episode. For patients who suffer from multiple episodes of migraine, need preventative medications. Your doctor may prescribe daily medications to reduce the frequency of attacks, like propranolol or tricycle antidepressant like amitriptyline or topiramate an anticonvulsant. Non-pharmacological options, though not as effective but still can be tried. For example, techniques like acupuncture, biofeedback, can offer relief in some cases. A key consideration for a patient with migraine is when to see a doctor. While occasional migraines can be managed at home, see a doctor but you should see a doctor if your headaches become more frequent or become more severe, or you experience neurological symptoms like weakness or confusion. You may have a sudden, severe headache, often described as the worst headache of your life, also known as a thunderclap headache, which could indicate a more serious condition. This was all about migraine, a common and in some cases a debilitating condition, which once understood can be easily prevented and managed. By this way of living, you are taking control of your health. Migraines may be a part of life, but they don't have to control yours. With the right approach, you can significantly reduce their impact. If you found this video helpful, give it a thumbs up, share it with someone who needs it, and subscribe to MedEd 360 for more expert medical insights. Remember, understanding your migraines is the first step to conquering them. See you in the next video. Take care and stay healthy.